Hi Simone, how are you?
Good, how are you?
Good. I'm here to take your blood pressure. I'm Leanne, your CNA today. So I'm going to go ahead and sanitize my hand and get my supplies. Going to make sure to cover all surfaces and rub until they're dry. I'm just going to make sure my brakes are locked. And I'm going to go ahead and pull the curtain. I'm going to go ahead and get a barrier for my table. I need my stethoscope, my blood pressure cuff, my recording paper, alcohol swabs, and I'll go ahead and get a pillow for your arm. I'm going to raise my bed just a little bit. Okay, I'm just going to set your head of the bed up just a little bit, okay? So the arm has to be heart level, which it is, palm up. So to locate the brachial artery, the easiest way is just to draw a line up the pinky, above the bend of the elbow, and that's where you'll position your cuff arrow, and that's also where you'll place your diaphragm of your stethoscope. Again, you just draw an arrow up the pinky, and that's where you're going to find it. Going to sanitize my equipment. I'm going to clean the diaphragm. The earpieces. And also the earpieces for the observer. I'm going to line the arrow up to the brachial artery. Make sure it's about an inch and a half, 2 inches above the elbow. So I've placed the cuff on the arm. This is her right arm. Draw a line up the pinky, and that's where the arrow will be placed on the cuff. This is also where the diaphragm of the stethoscope will go, right here. You definitely don't want to put the diaphragm underneath the cuff. Try to get as much away from the cuff as possible. Okay, I'm going to go ahead and give the stethoscope to the observer. The observer will give me a number for loss of pulse. So at that point I will inflate my bulb 30 millimeters of mercury above that loss of pulse. The stethoscope needs to point in the same direction as your ear canals. So go ahead and put your two earpieces together, and it should point out like your nose. If it's pointed toward you, that means it's the wrong direction. And you just put them in your ears. going to place my stethoscope on the brachial artery. Make sure to get a good seal. I'm going to release my ear. I'll go ahead and write my number down. Okay, I'll go ahead and remove the cuff. I'm going to return my equipment to storage. All right, thank you, observer.
You're welcome.
I'm going to go ahead and lower the bed. Oops. Do you want to stay sitting up? Okay. All right. I'm going to go ahead and give you back your call light and your water. Make sure you can reach it. I'm going to dispose of my trash and put my barrier in the hamper. I'm going to make sure to fill out my form. I'm going to print my name at the top. Go ahead and sign my name on the bottom. And I've written my blood pressure right here, 88/56. At this point, I would give my paper to the observer. I'm going to go ahead and sanitize my hands. And let's go ahead and open the curtain. And I'm done with blood pressure.